Welcome to your roadmap to Medicare. Now, this roadmap was customized based on questions that you've answered, either by talking with our client services team or by going online and taking our online quiz. So what we're asking is, if you have friends or family that need guidance into Medicare, please have them either go online and take our quiz or schedule a consultation with one of our team members, because everybody's situation is just a little bit unique. And we want to make sure that people get proper advice specific for them. Because as we've discovered, there could be serious consequences for not enrolling in Medicare when appropriate or not choosing the appropriate coverage for yourself. So what we're going to talk about today is your roadmap. So you may qualify to enroll in Medicare after age 65 if you have what's called a special election period. And the most common special election period is coming off of group credible coverage. So group credible coverage means that you are covered under a group health insurance plan and that either you or your spouse was employed at the company that's providing those health insurance benefits. So as long as you apply for Medicare within 8 months of either coming off of the benefits or leaving employment at that company, then you qualify for a special election period. Now, you may need to enroll in both Medicare Part A and B, or possibly you could have enrolled in Medicare Part A when you turn 65 and may only need to enroll in Part B at this time. In either case, you're going to need to prove that you've had the credible coverage so you qualify for this special election period. And to prove that, it's going to require a form, and the form's called an employment verification form. You can get this on Social Security's website. We also have a link for that form that we can provide to you. And you're going to take this form to the employer that was providing the benefits, whether that's yours or your spouse's. And they're going to fill out the form saying that the primary insured was actively at work at the company and that you have been covered under those group health insurance benefits. And like I said, as long as you take that in without an 8-month gap in coverage or gap in employment, then you should qualify for the special election period. And you can use this form as your ticket right into Medicare saying, I'm ready to start on this date. And they say, okay, we'll get you enrolled. So you can either call Social Security and do some of this over the phone and then mail them the forms, or you can go directly to your local office. And we always encourage people to go directly to the local office. It may take a couple extra minutes up front, but in the follow-up process, it could save you a lot of time, because sometimes the mail doesn't get to the right department and doesn't get processed as quickly, and then trying to figure out where your form went to can be a little bit of a challenge. So we always encourage people, just visit your local office. And you can schedule an appointment for this visit by calling Social Security first, and they'll schedule an appointment for you at your local office. But sometimes there's a delay in that. We are seeing typical schedule times being 4, 6, maybe even 8 weeks out from when you make that call. So it's just as easy to go down to your local office and take an appointment on the first available basis. They'll handle you on a first come, first served basis for any walk-ins. And we normally recommend that you show up early. The earlier in the day you go, the quicker many times that you can be helped. So most Social Security offices open at 9 a.m. And if you show up at like 8:15 in the parking lot, you'll probably be one of the first people in line. You'll be helped really quickly after 9, and you can be on your way for the rest of the day. But we have heard from many clients, the later you show up, maybe 8:45, 8:50, there may be as many as 10, 20, 30 people in line in front of you. Typically at the end of the year, because a lot of people do retire on December 31st, at the end of the year, those lines do become longer, versus throughout the year, they're not quite as long. So you may have better luck if you're retiring mid-year rather than the end of the year. Now, when you get to the Social Security office and you hand them this employment verification form, normally there's no other documentation required. Every now and then they will require a marriage certificate if you're collecting your Medicare benefits under a spouse's work history, or they may also require what's called a Medicare Part B application. And what we're finding is many times they just verbally do that application with you right while you're sitting in the office. But if you're going to be the one going to the Social Security office on behalf of your spouse, then you're going to want them to fill out that form before you go, so that way you have that form prepared, so since they won't be live in person to do it. And again, we can provide you with that form, or you can find it on Social Security's website. So we strongly recommend that you enroll in Medicare as soon as your credible coverage situation ends. But I do want to go through some of the consequences just in case you're thinking that you may not enroll right away. So as we mentioned, you have an 8-month special enrollment period to get enrolled once you no longer have credible coverage status, meaning your group health coverage has ended or the employment that it was based on has ended. And if you don't enroll during that first 8 months after it completed, then you would only be allowed to enroll in Medicare one time of year thereafter during your general enrollment period. So each year you'll have an enrollment period between January 1st and March 31st. The problem is, though, that your Medicare will not start until the July after you enroll in Medicare. So if you find that your coverage situation ends or you need Medicare right away, it will not be as easy to get right away if you have to wait till your general enrollment period. So a lot of people have heard about penalties in Medicare, and this comes into play in your situation. If you don't enroll in Medicare when you're supposed to, you'll start to accrue a financial penalty that will be added to your Medicare premium later. So let's break that down between Medicare Part A and Medicare Part B. Medicare Part A, many people get at no cost, a $0 premium. And the way you get Medicare Part A at no cost is by either you or a spouse having paid your Medicare taxes for a minimum of 10 years throughout your lifetime. And if that's the case, Medicare Part A has no cost, and there's no penalty for enrolling late in Medicare Part A either. But Medicare Part B would carry a penalty. And Medicare Part B does have a cost, and we do have another video that talks about Part B coverages and costs. But the penalty for Medicare Part B, if you do not enroll when you are supposed to, accrues at 10% for each year you wait. So if you wait 3 years to enroll in Medicare, perhaps you didn't know that you needed it, when you enroll, they will assess a 30% penalty, add it to your Medicare Part B premium, and you will be paying that 30% penalty on each premium, unfortunately, for the rest of your life. So it is financially important that you enroll in Medicare when you're supposed to, so you don't accrue this penalty. Then the last consequence would be potential holes in your coverage or gaps in your coverage, because once you are no longer actively employed or your coverage is not based on active employment, it is not considered primary coverage any longer. In fact, Medicare law says that once you are no longer actively employed, Medicare will take the primary payer position, and whatever coverage you have will sit secondary to Medicare. So if you don't have Medicare, which would have paid for about 80% of your medical bills, you now may be on the hook for the first 80% in round numbers of your medical bills, because your current coverage, which may have been fine and full comprehensive coverage previously, may not provide comprehensive coverage anymore and may only be on the hook to pay for about 20% of your bills. So one thing that I just want to mention is some of you may be eligible to maintain benefits after you're no longer in a credible coverage situation. So maybe you've retired, but you have access to COBRA benefits or severance package or even retiree benefits. So you might be thinking, well, hey, these are the same benefits I had when I was working and they provided really good coverage. So why not just continue with that? Do I really need Medicare at this time? Well, as I mentioned, Medicare law says that Medicare becomes primary once you're no longer actively at work. However, some of these group health plans decide that they will, in fact, agree to remain the primary payer for you. So if you think that you're not quite ready for Medicare yet and you're happy with your other coverage, go back to that employer or that old employer and ask, will this coverage remain the primary payer now that I'm no longer actively at work? Or will I need Medicare to have primary insurance now that I'm no longer actively at work? And of course, if they say that it will become primary or will stay primary, then you're going to want to get that in writing because you don't want to find out at claim time that you got some misinformation. But if that's the case, then you may be okay for a little while. But even so, I do want to caution you because the penalty and the deadline situation does not change. So you would still want to enroll in Medicare in an adequate amount of time to hopefully avoid those penalties or deadlines later. So, like I said, there's a lot of complexities into when to enroll, especially when you have other benefits right now that you like, and maybe you have somebody subsidizing some of the premiums for you. So we can talk that through with you and help you pick out the right timing for when to enroll in Medicare. So you're not paying for premiums on a plan that you don't need, but you're not finding yourself in a position later where you can't get the Medicare coverage when you need it. So the question becomes, does it make sense to enroll in Medicare with Medicare secondary insurance at this point, or does it make sense to keep the group health insurance as the secondary insurance? At this point, we've discovered that since Medicare is primary, you have to enroll in Medicare Part A and B anyway. So what we need to do is we need to compare your current group health plan versus the Medicare secondary options to see what may be more cost effective to you. So Medicare has several different versions of secondary options. There's Medicare Advantage plans, which tend to have lower premiums, but possibly higher copays. And then there's Medicare Supplement plans, which have higher premiums, but typically little to no copays. So we can talk about the differences in that, or watch some of our remaining videos that talk about the differences between Medicare Supplement and Medicare Advantage and what the options are. But on average, what I would use as a starting point to compare is about $150 to $200 a month. Do you think under your current group health plan, you are experiencing on average about $150 to $200 a month in expenses? So that would be your premium. So just think about what comes out of your paycheck in premium. And bear in mind, if it's you and a spouse, we need to figure out what portion is for you and what portion is for your spouse, because it may not be the same. Many employers make higher contributions towards premium on the employee than they do for the spouse. So sometimes we find that it's more cost effective for the dependent spouse to come off of the group health plan when they turn 65, but maybe the employee will keep the group health plan because the employer is paying the bulk of the premium for them. So I want you to think about your premium costs plus your out-of-pocket costs for utilizing the plan. And do you think on average that's more than maybe $2,000 to $2,500 a year, or about $150 to $200 a month? If it's less than that, then most likely your group health plan will remain more cost effective as your secondary coverage. But if it's more than that, then Medicare secondary, whether it be Medicare Advantage, Medicare Supplement, and or a standalone prescription plan, that may be more cost effective for you. So what I encourage you to do, don't make a decision based on that number, but let's look at the numbers. Let's do a cost analysis, and we offer these at absolutely no cost to you. Just let us know and we'll put together the costs of the Medicare programs that might make most sense to you versus your group health insurance plan. Then you can make an informed decision as to what's most appropriate for you to do moving forward. So another consideration when choosing to keep your group health insurance as secondary coverage to Medicare, or to choose Medicare secondary coverage, is underwriting. And the underwriting is different depending on when you apply. So when you first become eligible for Medicare Part B and enroll in Medicare Part B, you have a 6-month open enrollment window to get any Medicare supplement plan you want with no medical questions to qualify. Now, if you don't get it in that first 6 months, maybe because you're staying on your group health coverage, when you go to enroll later in that Medicare supplement plan, you will have a guaranteed issue period with no medical questions, but only certain plans qualify for that. So if you wanted a plan outside of that guaranteed issue offering, you would have to answer medical questions. So many times it makes sense to look at the benefits of Medicare secondary coverage now and how they compare to your group health coverage. And if it's close and you think underwriting might be a concern later, then maybe moving into Medicare as secondary when you first enroll in A and B may make more sense for you. But at least by looking at it side by side, you can come to that educated decision as to what is most appropriate for you in your specific situation.